Hello, everyone. My name is Elena Sturman. I am the President and CEO of the Glaucoma Foundation. Welcome to this evening's webinar with Doctors Anu Lowell and Rebecca Marinov, Low Vision and Glaucoma, Making the Most of Your Sight. Our experts are here to discuss how glaucoma can impact your vision and your ability to complete everyday tasks, as well as what can be done to maximize your visual function. We will learn what a low vision specialist is, what a low vision exam entails, and we will explore some of the adaptive technologies that are available for people with low vision. As always, we will reserve time for questions and answers at the end of our session. You can ask a question by using a chat or Q&A button on your screen, and we will do our very best to answer as many questions as possible. Before we begin, I would like to introduce our speakers. Dr. Anu Lowell has been on the clinical faculty of SUNY since 2016. Prior to SUNY, he served as clinical faculty at Johns Hopkins School of Medicine and the Ohio State University College of Optometry, where he was the chief of the Ocular Disease Service. He graduated from the Michigan College of Optometry, followed by a residency in ocular disease of the Ophthalmic Consultants of Boston, New England College of Optometry. He is the instructor of record at the ophthalmic lasers and in-office surgical procedure course and the role of the optometrist in the surgical care elective. Dr. Lowell is member of American Academy of Optometry, the American Optometric Association, the Optometric Glaucoma Society, and is board certified by the American Board of Optometry. Dr. Rebecca Marinov is an associate clinical professor at SUNY College of Optometry, where she also serves as a low vision rehabilitation residency supervisor. She provides patient care in a vision rehabilitation service in both low vision and vision therapy clinics. She is an instructor of record in a low vision course elective and clinical decision-making class. Dr. Marinov completed a residency in low vision rehabilitation at Southern College of Optometry and is graduate of SUNY College of Optometry. She is a fellow of American Academy of Optometry, a low vision diplomat of the American Academy of Optometry, a diplomat of American Board of Optometry, and a distinguished fellow of the National Academies of Practice. Dr. Lowell will start our presentation. Let's begin.
Great. Thank you so much for having me. I'm going to share my screen here. So before we begin, one thing that I just want to mention here is, for one, it's an honor to be here to speak to everyone here today and be a part of this webinar. The Glaucoma Foundation does such amazing work. One of the big things that they do, of course, is patient advocacy, funding when it comes to research, and then, of course, patient education. And this is why we're here today. So we're going to have this educational webinar. Now, this webinar is mostly geared towards patients and family of patients, but I know there are also some practitioners here as well. So hopefully somebody will get something out of it. That's really the goal of this webinar here today. What we'll be talking about is low vision and glaucoma, because we know that glaucoma affects your vision. I'm going to be talking about really the two major ports here on the top. So how does glaucoma affect your vision, and how does glaucoma impact your ability to perform everyday tasks? And then the heavy lifting will be done by Dr. Rebecca Marinov here, one of my colleagues here at SUNY. I'm very lucky that I'm able to refer patients over to her. So I see a lot of my patients at the glaucoma service. She is somebody who, helps patients really maximize the vision that they have so they can live a good, fruitful, functional, and happy life. When it comes to glaucoma, just as a benefit of some of you folks who are maybe new to glaucoma, glaucoma is an optic neuropathy. It is a progressive disease of the optic nerve. So again, the word neuropathy means disease of the nerve. The optic nerve is our cranial nerve number 2. It takes information from our eye and sends it over to our brain. And progressive means that if, of course, it is untreated, it can progress, it can worsen over time. Now, as you can see from the definition, the major modifiable risk factor or variable to treat glaucoma is reducing your eye pressure. That's probably why when you go to your eye doctor, they're kind of obsessed. Glaucoma docs are obsessed with your eye pressure because we know that by reducing the eye pressure, we reduce the patient's risk of progression in glaucoma. That's really the big tool. Now, there are other things that can reduce the patient's eye pressure, but they're all supplementary as opposed to some of our big treatments that usually include things like medications, so eye drops, things like laser procedures. There's some implants that can put in, and then of course some surgical procedures help lower the eye pressure as well. Now, to help conceptualize it, there's this nice little video from the Academy of Ophthalmology where you can see that inside of the eye, there's a fluid that gets produced in one area and drains out of another area. So you can see it draining out here. However, with patients who have glaucoma, as you can imagine, there is a blockage of that drainage in a lot of cases, or maybe an overproduction of the fluid. And if the pressure in the eye tends to elevate, it affects the optic nerve, which takes that information from the eye towards the brain. And damage to that optic nerve, these are the fibers or the cables that take that information to the brain, usually get affected. Now, when we go in and we see patients in the glaucoma service like I do, the main things that I check on my patients are things like their visual acuity and their visual field. These two things here. Now, visual acuity, as you may or may not know, is just really how well you can see on the eye chart, on the eye test, how far you can get down on the line. And the visual field, well, we had a whole lecture on visual field by Dr. Gus de Moraes and Dr. Manos Tasumis last time. And if you have not seen that, it's actually on the Glaucoma Foundation YouTube page. So please, definitely check that out. But in essence, a visual field is just giving us an idea on how sensitive your eye is in a certain spot or a certain location. We're looking at points of sensitivity. So in this diagram here, you can see that the dark points, this is just a area where the sensitivity is not as high as opposed to other areas of the visual field test. And like I said, if you're unfamiliar with the visual field, please check out that webinar. It was a fantastic webinar that Dr. De Moraes and Dr. Summers did. The other thing is that when you go ahead and you look online on how does glaucoma affect somebody's vision, you might see a diagram like this. You Google something and this is what it looks like. And I think this is a pretty good diagram just to kind of explain that glaucoma usually affects folks' peripheral vision, which means that most of the damage sometimes affects the far peripheral area before it affects the central area. However, that's not always the case, unfortunately. And to be honest with you, there was a great paper done by Dr. David Crabb. He's a PhD researcher based out of the UK. And in his paper, he talked about the different patterns of visual field loss that a patient can have secondary to glaucoma. And as you can see from the diagram here, all of these patients have a sensitivity of minus 5 dB. So we measure sensitivity in decibels. You might be familiar with measuring sensitivity in decibels because that's how we sometimes measure hearing in decibels. So guess what? We use it in the eye as well. We use decibels. So a normal patient on a visual field test, if it says 0, that means that their sensitivity is exactly how it's supposed to be. However, if there's a deficit, if there's a minus 5 dB, so we have a 5 decibel worsening, you could see that the patient's sensitivity is lower than what the average person's sensitivity is or what the expected sensitivity is. But you can see from this diagram, areas of glaucomatous loss can affect different areas of a visual field. And to give you an idea, so that cross here that you can kind of see, that essentially the center of that cross is our central vision. So glaucoma can affect areas within our central vision and can disrupt our everyday life as a patient. And in fact, in this paper by Dr. Crabb, what he looked at here is he actually spoke to glaucoma patients. He had them fill out a survey. And the vast majority of patients did not say that their vision looked like a black tunnel or black missing spots. What most patients said is that things looked like this here, where there was missing either blurred spots or missing spots where spots were kind of missed and then maybe, pieces of it were somewhat filled in. So that's how people tend to describe their vision. So it's not typically that black tunnel vision. And when he asked them to do a what word that they would associate with their glaucoma, you can kind of see that the words that they used were things like missing, fuzzy, blur, side or disappear. So you may not think of a patient, having just a black spot that's missing. A lot of folks notice blur and fuzzy areas as well as their complaints. But when you think about a complaint as it is, well, I think one of the more important questions that you should be asking is maybe what what causes that you're finding that are becoming a little bit more difficult for you secondary to your glaucoma? What types of tasks are you having more difficulty with? And again, looking at that word cloud from that study by David Crabb, reading was a big one. Driving, walking, bumping, shopping. Those are everyday tasks that, a lot of us, kind of take for granted. Whereas those folks with glaucoma, unfortunately, their vision is somewhat affected by it. And we do have some research behind it as well. I'm going to go over just a few research things here, and I'm going to go over it very, very quickly, but the references are there for you. So if you are interested in reading up on the paper, by all means, definitely do so. There's a big group, of course, led by Dr. Ramalu out of Johns Hopkins, who's done a lot of research both on reading speeds, but also on falls. And as you can imagine, those folks that do have glaucoma, it really affects their ability to read. It affects their reading speed. When you look at this diagram here, what it's really showing you here is that this is kind of large text, this is small text, and then this right here is reading speed. So the increase in reading speed. So you can see that those folks that don't have any glaucoma, they're up here. The reading speed is pretty good. And of course, the smaller the text, the harder it is to read. If somebody has glaucoma in one eye, that's the middle one here. And if somebody has glaucoma in both eyes, I mean, it significantly affects their ability to read. So patients may not find reading as fun and as enjoyable as they once did. So if I look at this passage right here, I can read it relatively quickly and easily. But if there were patches that were blurred, you can imagine that I would have to maybe move my eyes around a little bit more. I would have to spend a little more mental energy trying to figure out what that word was. So unfortunately, those folks with glaucoma, they may say that even though their vision is 20/20 and their doctor says, hey, things are going great for you, things are stable, your pressures are good, your vision is good, they still may have difficulty with tasks that they like to do. They may find themselves reading a little bit less. Other things that patients may speak about are things like bumping and falling into things, and that is a big concern for us. Patients falling and hurting themselves, particularly as we get older, it is kind of a big deal. I mean, it's debilitating. And again, we do have research on it, which really shows us that as visual fields tend to worsen, the risk of somebody falling also does tend to increase. And particularly if the rate of worsening in their glaucoma is a fast rate, so you can kind of see here. So if the rate is increasing, i.e., things are getting worse, their likelihood of falling also increases as well. And like I said, falls can be somewhat devastating. Now, this study that again from Dr. Romelu, he ran this group of studies called the Falls in Glaucoma Studies, FIGS. This study actually somewhat surprised me. In this particular study, what he did was he gave them a calendar where they would check off if they fell or they didn't fall for that day. And he looked at falls at home and he looked at falls away from home. And each patient was actually outfitted with a GPS, which monitored their steps, right? And like I said, what was surprising to me is that a lot of the falls, most falls happened at the home. And you would think, wait a minute, this is a space where people are familiar with. Now, there's a lot of hypothesis why this would have happened. I mean, for one, maybe a little more clutter in terms of their furniture. their color of furniture. Maybe when you didn't have glaucoma, you had a certain color scheme, and now that you do have glaucoma, the color scheme is more impactful. And I think Dr. Marinoff will talk about that here in a few minutes. The other thing is that lighting, maybe be dimmer in the home, or maybe because you're comfortable in the home, you may not turn the lights on. You're in the middle of the night, you want to go to the bathroom. You're like, oh, I know where the bathroom is. I can walk to the bathroom, no problem. And then you go ahead and trip on something. So again, it's one of these scenarios where, unfortunately, falls at home are an issue. And you found that in this particular study that the falls, unfortunately, more falls with worse visual field damage. And I think it's super important to really work with low vision occupational therapists to make the home and other workplaces a lot more safer for patients to identify hazards and prevent patients from falling. Other tasks that I wanted to mention here as well is shopping. Patients do have difficulty, glaucoma patients particularly, do have difficulty with shopping. There was a study that actually looked at exactly this. In this particular study, what they did is that they gave patients essentially a list of items that they needed to grab. And there's a camera on the back end here, and there's a camera towards the front end here. And patients were asked to go to the drugstore and pick out certain elements and items. And those folks with glaucoma, unfortunately, they had more errors. So picking up the wrong item, you might think that you're picking up shampoo, but you grab the conditioner bottle instead. And it took them a lot longer to navigate, right? And, these types of spaces, if your glaucoma tends to worsen, can be somewhat overwhelming. You may not want to go to the grocery store. You may not want to go to the drugstore because it's so difficult, for you to navigate. Luckily for us nowadays, we can order things online. And I think a lot of my glaucoma patients do. But this is just an example on how glaucoma can affect a relatively, what we call like a normal and menial task that a lot of us without glaucoma may take for granted. And then the last thing I'm going to mention, because I only have about 20 minutes here, so I have about 2 minutes left. The last thing I'm going to mention is driving. Now, I live here in New York City. The vast majority of my patients use public transportation or, Uber or, some Access-a-Ride and other things like that. But of course, many of you who are listening to this webinar live in places where driving is essential. You can't get to the doctor's office without driving. You may not have the accessibility to taxi cabs and buses and subways. And driving is maybe the only way to really get to where you need to get to. Now, there's been a lot of reviews on driving. A few studies that were done looking at surveys, so looking at patients who have glaucoma comparing to those patients that don't have glaucoma, and looking at surveys on the number of motor vehicle accidents. There's been some other studies that look at simulators, so putting patients who have glaucoma behind a driving simulator and seeing how well they can manage hazards and things like that. And we know that glaucoma affects things like contrast sensitivity and glare, which Dr. Marinoff will talk about here in a few minutes. But those types of things are essential because if you can imagine in cloudy conditions or under rainy conditions where the contrast may not be so good, or on dawn and dusk where the glare might get into your eyes, you might have a little bit more of a difficulty with those situations. But a lot of these studies were done over the past, 20 years or so, or 20 or 30 years. In this review, it mentions that yes, there's a trend to maybe a higher risk of motor vehicle accidents in patients who have glaucoma, particularly those who have a worsening in their useful field of vision. That's what this acronym means here, is a strong indicator of motor vehicle collision. However, I will say this, is that over the last 5 years, things have definitely changed. Because of the fact that patients with glaucoma, some patients with glaucoma, because they know that they have glaucoma, they may not drive as often. They may instead drive only in very familiar environments. Some of these patients who have glaucoma might be extra careful, right? As opposed to, we all know some people who are very normal sighted, yet are horrible drivers in general. So glaucoma alone is not the cause of motor vehicle accidents. Um, and the other interesting thing is that now with newer technologies, I think it's a lot safer. So, for example, cars now are built in with things like automatic braking. If there's a hazard, lane assist, so it prevents you from veering out of your lane. Blind spot monitoring. So when you are turning to change lanes, for example, it actually monitors your blind spots. So, this whole idea of glaucoma in driving, I think it's still evolving, and the regulations for those folks for driving who do have an eye disease like glaucoma does vary state to state. And like I said, I think Dr. Mironov can maybe elaborate on that a little bit. So with that, again, I know I went through that very, very quickly. I only had 20 minutes, so we're at 5:20 right now. So I know I only had 20 minutes to go ahead and go over that for you. But I left the references there. And again, feel free to reach out if you do have any questions. And I'm going to go ahead and throw the screen over to Dr.
Okay, thank you, Dr. Lowe. Good afternoon, everyone. It's my pleasure to be speaking with you today, and I'm so glad to be doing this webinar together with Dr. Lal. And so just a little moment to get the screen ready. So I'm going to start by going back and completing that area of how does glaucoma impact vision. Dr. Lal has already gone over visual acuity and visual field, and I'll be concentrating on contrast sensitivity and glare sensitivity for this part. So what is contrast sensitivity? That's how the ability for us to tell an object from its background. And with glaucoma, this is often what's impacted first. With glare sensitivity, many people are uncomfortable when it's very sunny outside or in bright lights indoors. But the difference is that the increased glare sensitivity with glaucoma doesn't just mean that someone is uncomfortable, but that the glare is preventing them from seeing what they need to see. And so here is a picture showing a simulation of contrast loss. So on the left, we have a picture of two children, and this is a simulation of cataract, contrast loss from cataract. And many patients have glaucoma and cataract at the same time. And so we see just an overall haziness to the picture. And on the right-hand side, this is an example of a high contrast street sign and low contrast street sign right next to each other. So the sign on the left, it's very easy to tell we're on 44th Street. We have a green background, bold white numbers. But on the right side, the background of that sign has faded a lot, and so it's very hard to tell what the print says. With glare sensitivity on the left, we have a photograph showing Christmas lights on a home and a tree. But then on the right side, with that increased glare sensitivity, there can be halos around lights, and just the effect of the glare obscures. It's very difficult to tell that we're looking at a tree and a home, and it can all kind of get jumbled. So what does this all mean? So if a patient has contrast loss, the vision can be hazy. This can cause an increased risk for falling and injury. And with glare sensitivity, the vision can seem washed out. And so for patients with glaucoma, it's not one or the other that's happening. Patients can have reduced side vision and contrast loss and glare sensitivity all at the same time with the combined effect, and with advanced glaucoma, reduced vision as well. And so someone may be able to read tiny letters on the eye chart, but they're viewing it through haze and perhaps that blurriness that comes with the side vision as well. And so now moving on to going over what is low vision, a low vision specialist, what happens during a low vision exam, all to answer the question for those in the audience who may have glaucoma, do you need to come for a low vision exam? So what is low vision? The textbook definition is reduced vision, not correctable to 20/20 with traditional glasses, traditional contact lenses, or cataract surgery because of pathology such as glaucoma. The broader definition, the one that I use, is reduced vision that's impacting function. Someone isn't able to do the things they want to do or need to do because of their vision impairment. And it's important to remember that low vision is relative. Each patient is an individual. Vision impairment affects everyone differently. And in the low vision clinic, we are treating everyone as an individual. What are their personal needs and how can we best address them with something customized for that patient? Look, it's important to remember that low vision is not the same as blindness. Patients who have low vision have both useful and usable vision, which can often be improved with magnification devices or other types of devices that I'll go over. Low vision services are not going to cure the glaucoma. They're instead going to allow a patient to utilize the remaining vision to its fullest potential to maximize it. Having low vision care does not mean you don't need to see your glaucoma specialist. It is important to continue seeing your glaucoma doctor and getting that medical and or surgical intervention that's recommended for you. And the flip side of the coin is that seeing your glaucoma specialist and getting that medical or surgical intervention does not mean you don't need to also see a low vision specialist. And as Dr. Lull said, we share a great number of patients who see both of us. So what is a low vision specialist? All optometrists learn about low vision in school. Many, but unfortunately not all optometrists, see low vision patients as part of their training in school. Different states do have rules about who can call themselves a specialist and who's not able to. But a low vision specialist like me typically had additional training beyond what everyone learns in school. This could be a specialized clinical rotation concentrating on care of low vision patients, completing a residency, which is concentrated clinical care, learning about the ins and outs of providing low vision services. Someone can also have one-on-one informal training with a mentor, sort of like an apprenticeship. And then doctors can work toward earning different credentials as they work through their career. And one could be an additional credential in providing low vision care. And so what happens during a low vision examination? I'm going to go through each of these in turn. So the first step is to have a conversation. We ask a lot of questions and have a discussion to determine what are the everyday tasks difficult for that particular patient because of his or her vision. This can have a wide range. I've listed the most common things that come up. It could be reading, seeing the television, seeing street signs, kitchen tasks, being able to tell medications apart, managing glare. There's many more things that we do in our everyday lives. This is a sampling. And then once we have an idea of what the patient is looking to do, the next thing is determining what is that patient's visual system capable of doing. So we're going to assess visual acuity. We have different eye charts to give us a better sense of more precisely what is the patient's vision. We perform visual field testing. That's a little different than what is performed with a glaucoma specialist. And we perform contrast testing. Does the patient have reduced contrast and to what extent? We're also going to help that patient find the best glasses prescription for them. And then we do what I call building a bridge, which is what are the devices and services that can help the patient to do the things they want to do or need to do with their current level of vision. And so we can trial and make recommendations for a number of different types of devices, whether that's special glasses, magnifiers, the wide range of available technology, tints and filters and lighting, and I'll be talking about each of these. And then also not forgetting about services. The low vision optometrist is part of a team that includes not just medical providers, glaucoma specialists, but also a whole host of other rehabilitation professionals that can help the patient in different ways, whether that's specialists to help patients get around more safely, occupational therapists, or other rehabilitation therapists that can either go into the home or provide services in an institutional setting, specialists to teach patients the wide range of technology, specialists that can help a patient to find a job in an adaptive workplace, and mental health professionals as needed. And so I'll be going through the different types of glaucoma and what we can do in a low vision evaluation to help each type. I will start off by saying that I don't typically see patients who have mild glaucoma. Typically, patients with mild glaucoma don't have symptoms. They don't have reduced vision that we can measure on an eye chart, and they don't have noticeable loss of side vision. But as Dr. Lal talked about, there can be a range of impact for mild glaucoma. And so there may be patients listening who have mild glaucoma and are noticing symptoms. Mostly, I'm seeing patients who have moderate and advanced glaucoma when I see low vision patients. And so these conditions are on a spectrum where the visual field loss and contrast loss can worsen as the glaucoma becomes more advanced. And in advanced glaucoma, when visual acuity may also be impacted, we can address that as well. So I'll go over these 5 areas where we can help patients, where their complaints are typically centered. And so the first thing I'll talk about is helping patients to compensate for their field loss. We have some different tools that we can show patients. The first tool is prism. So prisms are special lenses that can help patients be more aware of what's happening in the areas of side vision that are missing. It can help redirect what's happening on the side closer in toward where the side vision is still remaining. Next is a minifier or reverse telescope. These both work the same way. If you look at the picture on the left, you'll see that there are these 2 posters on a bulletin board, and they're taking up a lot of space. And what the minifying lens does is it shrinks and compresses the image so that everything that's taking up a large amount of space can be shown in a small area to fit into the patient's remaining side vision. This isn't something to look through all the time, but for example, you're going to an appointment at a new location and you need to figure out where's the reception desk, where's the elevator, where are different rooms you need to get to. And so you can hold it up or look into it if it's on a pair of glasses and sort of orient yourself. And so it's one tool in the toolbox. Another tool, mobility training. This is working with a specialist to learn to navigate in adaptive ways given loss of side vision. This can include training to use a red and white long mobility cane to detect obstacles on the ground, navigate curbs and steps, but that's not the only thing that patients would learn from a mobility specialist. For reading, we have a number of different types of things we can offer patients if they need help with reading. One is reading glasses, and these are typically a stronger power than traditional reading glasses to provide magnification, and they come in a wide range of powers so that we can help patients who need those different strengths. There are also different kinds of magnifiers. So if you look in this photo in the bottom center, those are examples of hand magnifiers. Can help someone to read a medication bottle or a label on clothing for laundry. In the top right-hand side, we have some examples of stand magnifiers. These can be put on top of a newspaper or a book, magnify the print, have lighting associated with it. And in the top left, we have an example of an electronic magnifier. So the hand and stand magnifiers have one strength, where the electronic magnifier has a range of strengths built into it, and also the ability to show different color and contrast filters. And so each of these are options for the patient depending on their vision and what they'd like to do. Also for writing, we can talk to patients about and show them bold pens and markers for writing when a traditional pen or pencil is difficult to see. And then there are a large number of types of writing guides available. So for patients to help them to track across and write a letter or fill out an envelope, a check, sign their name on a form. There's a lot of things that can be done on our phones and tablets. We're using these every day. And so there is a lot of adjustability in terms of the display. We can make font bigger, bolder. We can change contrast and color settings to help make the display of the phone easier to see. For patients who need more help than what can be done visually, There are text-to-speech options where the phone can read texts and emails to you, and a patient could make a call using their voice and giving commands that way. And for patients who find it very challenging to read a printed book or newspaper or even digitally, there are audiobooks available. So there's a wide range. In terms of enhancing contrast, I mentioned that's usually what's impacted first. We will go through some tints and filters, so we can show tinted lenses that come in a wide range of colors and range from dark to light. And so these can be in traditional glasses lenses, or they can be in a wraparound frame and can help patients both indoors and outdoors to manage their glare. Additionally, lighting can make a very big difference for patients who have contrast loss. The photo on the right shows an example of a desk lamp. This is called a Stella lamp. It has a number of settings for brightness and color temperature to help find the right one for each type of patient for when they're doing things like reading or engaging in a hobby. In the center, we have a picture of a flashlight. Glaucoma can cause difficulties with night vision, and having a small flashlight with bright LED capabilities can help the patient to be able to get around more safely when it's dark outside or dim environments. On the left, we have a picture of a battery-powered puck light. So this, you can press it to turn on, and it has an adhesive on the back, and it can go underneath kitchen cabinets. It can go into a closet, so we're adding light to parts of our home that may not have enough light. And in terms of using color and contrast in our homes to make our space more functional, I can talk to patients about this, but there are occupational therapists or rehabilitation therapists that can go into the home and can show patients how to use lighting, contrasting colors, and different types of contrast to help make things more easy to see, tell things apart. Where is the light switch? How can I cut things more safely? Large print timers. There's a whole host of things available. Most kitchens everything is white. The floor is white, the cabinets are white. It's beautiful, but it can be very challenging if you're visually impaired. And the same thing for bathrooms. Most bathrooms can have harsh lighting, white cabinets, white sink, white counter, white floor, white tile. And again, that use of color and contrast can help make the space more usable and more friendly for patients who are visually impaired. In terms of glare control, I've spoken about the tints and filters, but an important environmental modification for the home can be these adjustable shades. So these are shades that, not just like a traditional blinder shade that opens just from the bottom, but they can open from the top, the bottom, or both, so that as the sun moves during the day, we're controlling how much sunlight and glare is coming into the home. Changing gears, I'm going to talk about just a few examples of some new adaptive technology out there that can help patients with low vision. So one example is the Orcam My Eye. So this is, so if you see on the picture with the glasses, so this little black rectangle is the unit. It attaches to the glasses, and then the user points to either an object or a page of text, and the device takes a picture and reads it out loud. And so it can tell you what the object is, read the print. If you program in the faces of people that you know, it can remember and tell you who it is when they are approaching. And this device can also function to read barcodes, to identify money, and to identify color. And the latest version includes what they call intuitive artificial intelligence, AI, to help describe what's in a room, answer questions, summarize the text that it has taken a picture of. There's also a device called, technical difficulty. What has happened? Sorry for the technical difficulty. I don't know why it's spinning. Here we go. So the Read 3 is a handheld unit and it only does the reading function. So it can read either a portion of the page or the entire page to the user. It has AI assistance in the newest model. It also comes with a stand and can connect to the computer and act like a magnifier in that setup as well. And so the latest version, also incorporating AI, it can not only read and magnify the print, but summarize and search the text as well. Okay, the computer is thinking. My apologies. We'll just give it a second. Hopefully it will continue on. Okay, so the next device is called Envision glasses. So if anyone remembers the Google Glass, it's based on that technology. So there is a camera in the front, and that's going to scan the environment. And then you see this black temple. So this has the controls in it. It has a speaker in the back as well. And so the camera can give information about the environment transmitted through the speaker, and can also make phone calls, help recognize faces. And so this can also interface with some other technologies, such as the IRA app, which is an app with trained volunteers to help patients to navigate. It can also connect with an app called Be My Eyes, where there are lay people volunteers who can sign up to help visually impaired patients. And then the latest version, there is what's called this Envision Companion, where a friend or family member can be added to the app and they can see through the camera what the patient sees and offer assistance as needed. Again, this latest model is incorporating AI to either interpret graphs and other types of text, and then giving these accurate descriptions. It's including software that helps it to learn what the user is looking for. And finally, the Ray-Ban Meta glasses. So these are what are called smart glasses, incorporating a camera and a microphone. And the device is able to take photos and video and also allow the user to listen to audio. It has speakers built in and can connect to Bluetooth. There is a way to interact with a digital assistant, an AI digital assistant through voice commands. So just as you could say, "Hey Siri" or "Hey Google" to your phone, you can say, "Hey Meta" to the Meta glasses. And you can also add prescription lenses. And so now we're up to our take-home points. So as we've told you, glaucoma can impact visual acuity, visual field, contrast sensitivity, and glare sensitivity. And together, these can result in impact to functions such as trouble with reading, driving, and an increased risk of falling. So if you are someone listening who has glaucoma and you feel that it is impacting your ability to do everyday tasks, I encourage you to let your current eye doctor know, and they are able to refer you to a local low vision doctor. And we've talked about the different ways low vision doctors are able to help patients. And for any providers listening, I encourage you to refer your patients with mild to moderate vision impairment. And this means that I and other low vision doctors can help the patient with simpler, less expensive interventions to start. So we thank you so much for your time and attention, and we're happy to take your question.
Thank you both so much for wonderful presentations. Dr. Marinov, if you could stop sharing your screen, we will
Absolutely.
get to the question points. Excellent. So our audience have been writing quite a bit, and let's start. So at what point in your glaucoma journey should you see a low vision therapist? Let's start with you, Dr. Marinov, and then Dr. Lowell, if you have anything to add to, please do.
So that's a great question. So what I encourage you to do, I find that sometimes patients are hesitant to tell their glaucoma doctor when they're experiencing difficulties. Maybe they're afraid they're going to be put on more drops. Maybe they're afraid they're going to be seen as not a good patient. And so I would encourage you to let the doctor know if you're having trouble reading, if you're having trouble seeing things far away, if you find that the glare is affecting you, and if you find that you're tripping on steps, curbs. So if you're having those difficulties, the doctor can then check to see what's happening with your glaucoma. They can check to see if maybe you just need different prescription glasses. And then if neither of those is enough, then I think making the referral is appropriate. So it's going to be a different point in the glaucoma journey for everyone, in my opinion.
Yeah, that's a great point. And I think one of the big things that that you mentioned is sometimes patients are scared to tell their glaucoma doc that, they are having difficulties, or they're perceiving that things are worsening, even though the patient's vision on the chart is actually doing quite well. And like I said, I come in and I talk to the patient about their eye pressure and their visual field and their scans. And I say, Miss So and so, things are looking great. We'll carry on with your current treatment. I'm so glad to see your pressures are doing well. That, a lot of glaucoma docs sometimes don't stop and ask their patients from a functional standpoint how they're doing. The other thing is that, when I see a patient, one of the first things that I ask them is that, yeah, how's your vision been? Are you having any more difficulties? And sometimes I see patients who may have a cast on their hand, or they seem to hurt their foot. And I always ask them, how'd you get that? And if they tell me, well, I fell, and I'm like, well, are you falling more often? Do you feel like you're having more difficulty navigating? Because that might be the trigger to send that patient over to a low vision specialist, where the patient might seem that, oh, this is my leg. It's completely unrelated to the eyes. I just lost my balance. Well, if I'm starting to see a pattern, I might say, you know what, this could be related to your vision. It might be worthwhile to get checked out. And if not, after seeing a low vision provider, it might be related to occupational therapist or a physical therapist. It could be related to muscle weakness and such, but you can't really forget about their vision.
Thank you both very much. Next question, similar to this one. When should a glaucoma patient consider using a cane?
That is an excellent question. So I think that for me, I'm going to perform the visual field test, see how much field is missing. I typically, when I was a young, very gung-ho doctor, I would recommend to patients, I think you could benefit from using a cane, and they would say, goodbye, Dr. Marinoff, I'm never coming to see you ever again. I don't need a cane. And so what I bring up is that, based on your visual field test, I feel concerned, are you tripping and falling or bumping into things, or any of those types of symptoms? And if they are, and it's not something where we need to change the glasses, it's not something, we can show those tints and filters to enhance the contrast. But if it's a combination of the contrast loss and the visual field loss, then what I recommend is, let's have an evaluation with a specialist where they can see what types of things can help you to travel more safely. And then the mobility specialist will do their evaluation, and they'll make recommendations based on the range of things that are available. So they'll mention the cane, and they'll maybe mention some other things that can help the patient as well. There's often strategies. But I think that, patients can feel very sad about, oh, that means I'm blind. But I don't think it's true. I think the cane is just another tool in the toolbox. And it's a tool to help you to stay safe, and a tool to help you stay upright and not fall and be able to go places by yourself. I have patients who don't want to use a cane, but then they feel they have to bring someone with them every time they want to go anywhere. And so that can be limiting. And so I don't like to say everyone should use a cane, no one should use a cane. I think it's important to be open to having the evaluation, to hearing what the options are, and then it's a conversation with the specialist. And then there's always, different options within something. So maybe the cane is something that someone only needs at night. Maybe the cane is something that someone needs when they're traveling in the subway, where there can be a very wide range of lighting options in the station, and on the train. And so maybe it's for sometimes, and maybe it's for all the time. And so I think that if, as a patient, you think about it as a tool and you use certain tools in your toolbox for different things, then it becomes less overwhelming, in my opinion.
Thank you very much. Anything to add, Dr. Lowell?
No, I think that that's really great. And I think the big idea here is that sometimes when patients hear it the first time, they're not ready to hear it. But when they hear it the second time or the third time, they're more willing to. And I think as a provider, I think the big thing to speak about is the fact that, I'm concerned about you. I don't want you to fall. I don't want you to hurt yourself. And it might get to a point where the patient's like, you know what, the doctor really does care about me. Maybe I should look at this therapy and see if that works for me.
Thank you both very much. Next question. Can the Meta Ray-Ban glasses be fitted with transition lenses, distance on top and reading on the bottom?
So that's a great question. So it would be a conversation with your eye doctor as to whether you should wear progressive lenses. If you're a person who has significant amounts of side vision loss, it may be safer for you to wear distance glasses when walking around, and maybe have separate reading glasses. But as far as I know, the Meta glasses can hold a variety of types of lenses.
Thank you very much. Next question. How do we explain the presence of glare in patients with glaucoma?
That's a great question also. So the way I explain it to my students and to my patients is that, when we are young children, if we don't have an eye condition, all the layers of our eye are nice, neat rows, and that means light comes in and goes out, and we don't have scatter. But if we have damage to any layer of the eye, whether it's the front surface called the cornea, that's the skin over the colored part, if we have a condition where we have missing parts of our iris, that's the colored part, if we have a cataract, if we have glaucoma, the light is going to scatter when it hits those parts of the eye that are having the eye condition affect them. And so it's the scatter that causes the glare, the light scattering.
Uh,
And it can affect the patient's contrast as well, which I think that's what makes things very difficult. And when you're explaining it to a patient, you may say, do you have extra difficulty, particularly at dawn and dusk? Are you finding that when you go to the grocery store where they use fluorescent lights, that's more of a problem as opposed to natural light? So kind of teasing that out on your patient might be, difficult to do. But once you get it, as Dr. Marinoff mentioned, testing out some of those tints that so when I send patients over to her, sometimes they come back and they tell me, they're like, oh, these tinted glasses on cloudy days, it's the best thing that ever happened to me.
Yeah, that's great. And some patients say that they see better when it's sunny, and some patients say they see better when it's cloudy. And for some patients, it's the opposite, worse when it's sunny, worse when it's cloudy. And so it's really everyone's unique situation. And the contrast and glare are two sides of the same coin, right? The same eye condition that affects different parts of our eye is going to cause the contrast loss and that glare sensitivity.
Thank you both. Next question. What is the price range for the new adaptive technology devices, and are any of them covered by the insurance?
Another great question. So at this time, the devices are not covered by insurance. The Meta glasses are the least expensive, ranging from about $200 to $300, depending on the particulars. The Envision glasses, the range was $2,500 to $3,500. And the Orcam, just the Read, the handheld device, about $2,700. And the My Eye is about $4,200.
Thank you. Next question. Is there a website where patients can search for low vision therapies in their area?
That's a great question. I don't know of a website to search for a low vision provider. The best source is your doctor, either your general eye doctor. Many patients with glaucoma have a general eye doctor who gives them glasses, and then their glaucoma specialist. It might be the same person or it might be two different people. So your best source is your doctor, whether it's your general eye doctor or your glaucoma doctor, because they're going to know who is in the neighborhood, or who is in the general area where you are located or where they are located. And so hopefully they have a connection.
And I would say, university eye centers, if you are close to an optometry school or a university eye center. And then there are, things like, foundations for the blind and other foundations that sometimes may have a list of providers in their area that offer certain types of services, whether it be Lighthouse or other types of places where you can send patients for low vision services.
And you can look up like your town and low vision doctor, but you would need to call the doctor to make sure do they take your insurance, and things like that.
Thank you both. So we have time for one more question, and here it is. I find that wearing my prescription sunglasses help me see better even indoors. Is there any drawback to wearing sunglasses or tinted glasses round the clock?
Another great question. So what I would offer is if you're more comfortable wearing your sunglasses inside, then that's a sign that you're a great candidate for tinted lenses. And I will also offer that the tint you need for inside is likely not exactly the same as the tint that you need for outside. So prescription sunglasses have about usually a 70% tint. Typically for my patients, I don't like to go above a 50% tint for indoors because, again, outside in the bright sun is going to be much brighter than any indoor environment. And so, again, talking to your doctor, either getting a recommendation for a low vision doctor, or if your doctor happens to do tinted lenses, and then trying different options to see if you need the exact same tint for inside. I would say likely not, but it's possible, and making sure you're getting the correct tint for inside. So that might mean two pairs of glasses, one tinted for indoors and one tinted for outdoors. That's something very common that I do for a lot of my patients.
Dr. Lowell, anything to add?
No, I think that was absolutely great. Yep, I 100% agree.
Well, we've reached the end of our webinar. I would like to thank Dr. Marinov and Dr. Lowell for amazing presentations. Of course, as always, our presentations are recorded and it will be available tomorrow on our website and on our YouTube channel. If you missed something, you can always look at it again. And of course, you can use the Glaucoma Foundation's website for source of information on your glaucoma and how to find glaucoma specialist and many other things. Thank you to our audience for participating. Have a great night. Wish you health and happiness. Bye, everybody.